Here's my room scan. Okay. Knock, knock, knock. Hi, my name is Tina. I'm your nursing student today. We provide privacy and perform hand hygiene. I do not need to wear PPE for this assessment. Can I get your name and date of birth?
Joseph Smith, 10/05/1954.
Just checking your band. All right, Joseph, do you have any allergies?
Sulfa and betadine.
All right, and today are you having any pain today, Joseph?
No, ma'am.
All right, so your healthcare provider has ordered me to give you medication based off of your pain level and your lab levels. So I'm going to go check your lab levels and then bring back the medication that you will need. Do you have any questions or concerns about that?
Nope.
And are you comfortable as to where you are right now?
Yep.
All right, I'll be back with you. All right. So, okay. So, for the digoxin, some nursing considerations are assess apical pulse, daily weight, check edema. For edema, monitor electrolytes, monitor input and output, and labs or electrolyte levels, digoxin serum levels. His digoxin levels were 2.2, so I will not be giving digoxin to him because it was too high. For oxycodone and acetaminophen, some nursing considerations are assess pain intensity, assess for constipation, monitor input and output ratio, avoid an older adult. Labs are amylase and lipase. I will not be giving him oxycodone and acetaminophen because he does not have any pain. For acetaminophen codeine, nursing considerations are assess pain, GI function, cough, monitor BP and CNS changes. Labs are AST and ALT, and I will not be giving this to him because he doesn't have any pain. For furosemide, some nursing considerations are assess fluid volume, otoxicity, monitor electrolytes, potassium, sodium, chloride, and magnesium. The labs I'm looking for are serum electrolytes, CO2, creatinine, and BUN. His potassium was 5.2. His sodium was 146, and his BUN was 21. So I am still allowed to give him his furosemide. For warfarin, some nursing considerations are monitor BP, assess for bleeding gums, black tarry stool, skin rash. The labs I'm looking for are INR levels, and his INR levels were 2.6, so they're within range. So I can give him his warfarin. So I'll be giving him warfarin and furosemide. Now I'm going to gather my necessary supplies, which is a cup and a water cup and a med cup. And I'm going to compare my MAR to my healthcare provider's orders. So I'm going to see first if there is a, I can't really see this. If there is a active order for furosemide. So for Joseph Smith, 10/5/1954, 10/5/1954. For furosemide, Lasix, 40 milligrams, by mouth, twice daily. For CHF, he's not been giving it to him, so I'm administering it at 1300. So that does give an active order for his furosemide. Excuse me. Now I'm going to see if there's an active order for his warfarin. So Joseph Smith, 10/5/1954, 10/5/1954. For warfarin, Coumadin, 5 milligrams, by mouth, daily. For atrial fibrillation. And he's not been given it yet, so I can administer to him at 1300. So there's an active order. So now I'm going to put away my healthcare provider's orders. Now I'm going to first take out his furosemide, Lasix. Okay. So, for Joseph Smith of 10/5/1954, for furosemide, Lasix, 40 milligrams, These are both 20 milligrams, so I'll be using both of them. So 20 milligrams is 40. By mouth, twice daily for CHF. The expiration date is 08 of 2038. 08 of 2038. The packaging is intact. I do not need to split or crush these. He's not been given it yet, so I can administer it at 1300. Now I'm going to be giving him warfarin Coumadin. Now I'm going to check if this is correct for Joseph Smith of 10/5 of 1954 for warfarin Coumadin, 5 milligrams by mouth daily for atrial fibrillation. He's not gotten it yet, so I can administer it now at 1300. Expiration date is 04 of 2041. Packaging is intact, and I do not need to split or crush these. Okay. I hope they can see this. Okay. Now I'm going to dump these out again, and I'm going to put my warfarin to the side and check my furosemide. So, for Joseph Smith of 10/5 of 1954 for furosemide, Lasix for 40 milligrams. So I'll be giving him 20 milligram pills. So 20 milligrams is 40. By mouth, twice daily for CHF. He's not been given it yet, so I can administer it now at 1300. The expiration date is 08 of 2038. 08 of 2038. The packaging is intact, and I do not need to split or crush these. Now I'm going to check for my warfarin again, my second check. So Joseph Smith of 10/5 of 1954 for warfarin Coumadin, 5 milligrams by mouth daily for atrial fibrillation. He's not been given it, so I can administer it now at 1300 today. The expiration is 04 of 2041. The packaging is intact, and I do not need to split or crush these. So now I'm going to gather my supplies, which is my meds and my water cup and my MAR, and I'm going to go to my patient's room. Okay. Knock, knock, knock. Hi, my name is Tina. I'm going to be your nursing student today. I'm going to provide privacy, perform hand hygiene, and I do not need PPE for this assessment. Can I get your name and date of birth?
Joseph Smith, 10/05/1954.
And Joseph, do you have any allergies?
Sulfa and betadine.
Okay, Joseph. It looks like, based off of your pain level and your lab levels, I'll be giving you furosemide for your CHF and your warfarin for your atrial fibrillation. Do you have any questions or concerns before we start?
No.
And are you in a comfortable position?
Yes.
Okay. Now, I'm going to do my third check for, first I'm going to put aside my warfarin, and I'm going to check for my furosemide. So Joseph Smith of 10/5/1954 for furosemide, Lasix, 40 milligrams. So I have two 20 milligram pills, so 20 milligrams is 40 milligrams. By mouth, twice daily for CHF. He's not been administered it yet today, so I can give it to him now at 1300. The expiration date is 08 of 2038. 08 of 2038. Packaging is intact, and I do not need to split or crush these. Now, I'm going to do my third check for my warfarin. So Joseph Smith of 10/08/1954 for warfarin Coumadin, 5 milligrams by mouth daily for atrial fibrillation. I will be administering at 1300, and I can administer it because he's not gotten it yet. The expiration date is 08 of 2041. The packaging is intact, and I do not need to split or crush these. I'm going to scan in each medication. Beep, beep, beep. I'm going to open them in front of my patient. Open all three of them. And now I'm going to scan my patient's wristband. Beep. All right. And now I'm going to, first I'm going to ask you, can you take your medication orally?
Yep.
And what is your preferred route?
Water.
Or your way? With water? Okay. Now, Joseph, I'm going to teach you a few things about both your medications, and I'm going to have you teach me back something about them, okay? Sound okay? All right, so for your warfarin, the action, it interferes with blood clotting. It's a blood thinner. Some adverse effects are hematuritic, caliphylaxis, hemorrhage, rash, anaphylaxis, nausea, and cramps. Can you teach me back something about that?
It's supposed to be a blood thinner.
Good. All right. And now for your furosemide, your action is inhibiting reabsorption for electrolytes, sodium and chloride, and it decreases your edema. Some adverse effects are circulatory collapse, loss of hearing, renal failure, and anemia. Can you teach me back something about that?
It is supposed to help with my edema.
Okay. So I have scanned your medication. Now I'm going to give you your medication. Do you have any questions or concerns?
Nope.
All right. I'm going to wait with you until you take your medication. All right. Have you swallowed it?
Yep.
Right. Now, write down on my MAR that I administer at 1300 for both my furosemide and warfarin. Initial it and put the date on it. All right. Now I'm going to, I will be back in 30 minutes to reassess to see if you have any adverse effects. And if you do have adverse effects, I will reassess vital signs, hold any other or any future medications. I will contact your provider, contact your pharmacy, and document per agency policy. Do you have any questions or concerns about anything?
Nope.
And are you comfortable to where you are right now?
Yep.
Okay. Now I'm going to give you your call light. Your bed is in closed position. It is locked. Your bedside rail is secured. Your room is clear of any hazards. And I'm going to make sure your bedside table is near. I did say checked your room for any hazards. And then I'm going to perform hand hygiene. The 5 moments of hand hygiene are before you touch a patient, after you touch a patient, before you touch a patient's personal items, before a procedure, and if your hands are visibly soiled. And now I'm going to collect and gather all of my supplies. And then I'm going to document per agency policy if I find any norms or deviations of norms. And then I'm going to upload this to Schoology.